Pues bien, buenas tardes. Los saluda Germán Sánchez. Gracias por acompañarnos a un nuevo seminario web presentado por Lifestyle BioHealth América. Esto en preparación para nuestro sexto Congreso de Medicina Funcional e Integrativa, MFI 2022. Que ya nos queda poco tiempo, estamos a escasas 2 semanas, semana y media, de que ya sea el Congreso y nos veamos, para quien pueda ir presencialmente allá en Cancún, y para quien no, también tenemos la opción de que lo puedan ver por streaming en tiempo real. Este webinar del día de hoy, por cierto, es patrocinado por Q.B.P Diagnostics, que estará presente en nuestro congreso con un stand. Entonces, si van al congreso presencialmente, no se lo pierdan. Ellos van a estar ahí con un stand para que los ubiquen y los busquen ahí en la zona comercial. Pues bien, antes de iniciar, quisiera estar seguro de que todos nos escuchan y nos ven bien. Si tienen algún problema, algún detalle que no nos escuchen o algo, por favor, envíennos un mensaje aquí por el chat o en la sección de preguntas y respuestas y con gusto les daré seguimiento. Por otro lado, también recuerden que al final tendremos unos 10-15 minutos de preguntas y respuestas por si alguien tiene alguna pregunta durante el transcurso del seminario web. Anótenla, pueden enviarla directamente por el chat, pueden hacerlo en la sección de preguntas y respuestas o al final tenemos la opción de levantar la mano para que me ayuden ahí dándole clic, le activamos el micrófono y ustedes pueden hacer su pregunta directamente. Pues estamos listos para iniciar con nuestro webinar del día de hoy. Nuestro webinar titulado Sensibilidades Alimentarias con el doctor Dorval, quien cuenta con más de 35 años de experiencia en la gestión estratégica de la investigación, la fabricación, los asuntos reglamentarios en el ámbito de dispositivos médicos y el diagnóstico. Recientemente, el doctor Dorval fundó Brent Bioscience para capitalizar las patentes de nuevos métodos de inmunoensayo para la detección de analitos. El doctor Dorval es doctor en microbiología e inmunología médica por la Facultad de Medicina de la Universidad Estatal de Ohio y realizó estudios postdoctorales y fue becario visitante en el Departamento de Química del Instituto Tecnológico de Massachusetts. Además, el doctor Dorval fue asesor en el Comité de Vacunas y Diagnósticos de la Organización Mundial de la Salud en Ginebra. También tendremos el día de hoy al químico Fernando Salinas, quien nos ayudará con la interpretación del idioma, con la traducción del día de hoy. Entonces, van a escuchar primero al doctor Dorval en inglés, posteriormente al químico Fernando Salinas traduciendo todo lo que diga el doctor. Pues bien, estamos listos para iniciar. Please, Dr. Dorval, go ahead.
Yes, good afternoon, good evening, everyone. Appreciate you attending this webinar. My name is Brent Dorval. I'm the CSO of KBMO Diagnostics, and we're here today to talk about food sensitivities and the role of food sensitivity testing and clinical outcomes using the FIT test offered at KBMO Diagnostics.
Hola, ¿qué tal? Qué gusto saludarles a todos y a todos. En esta presentación de KBMO Diagnostics vamos a ver el rol de las pruebas de sensibilidad en estudios clínicos. Gracias por estar aquí. Yo soy su servidor, Fernando Salinas, director científico de MedPrimex, y estaremos aquí traduciendo para ustedes en idioma español la exposición del Dr. Brent Dorval.
So first of all, let's just discuss a little bit about the topics for tonight, and we'll go over some background information that will be familiar probably to most people, but it's worth mentioning up front. So we're going to just explore the role of gut permeability and food sensitivities, especially the role in inflammation. We're also going to explain C3D testing and food sensitivities and why that is particularly important and why that particular feature is important in the KBMO diagnostic FIT test. We're going to discuss benefits of food sensitivity testing and patient compliance and clinical outcomes, which is very important. I mean, it's one thing to do testing, it's another thing to then line that up with clinical outcomes and show good correlation. Next, we'd like to look at and investigate a little bit the role of inflammation and explain that and how that's the root cause in many, if not all, chronic conditions that physicians and various healthcare providers see in their clinics and practice. And we're going to also explain the role of zonulin in gut permeability and food sensitivities.
Muy bien, los objetivos del día de hoy son los siguientes. Vamos a explorar el rol de la permeabilidad intestinal y la sensibilidad de inflamación a los alimentos. Un siguiente punto será explicarles el complemento de la sensibilidad a los alimentos mediado por la C3D, es decir, la subunidad D del complemento 3. Vamos a discutir los beneficios de la sensibilidad a los alimentos en sus pruebas con los pacientes y estudios clínicos de pacientes. Vamos a investigar el rol de la inflamación por alimentos como causa raíz de las condiciones crónicas de inflamación por alimentos. Y por último, vamos a explicar el rol de la sonulina en la permeabilidad intestinal y la sensibilidad a los alimentos. Go ahead, Mr. Brent.
So a few definitions up front, again, just by way of a recap. So food allergy, I think most of us know what that is. That's immunologic reaction. It's IgE mediated, and it's called type 1 hypersensitivity. That's the one where you eat peanuts, so you get a bee sting, and within a few seconds to a couple minutes, the reaction can be very severe and life-threatening. What we will talk about tonight is food sensitivities. And those are type 2, type 3 reactions, and they're immunologic reactions to food and various additives, and they're delayed type hypersensitivities, or DTH. That's why you may eat something on Monday and you may not see symptoms till Tuesday, Wednesday, even Thursday. Food intolerance, again, very familiar to this audience, is a non-immunologic reaction to food. And the most notable would be an enzyme deficiency. So you have the enzyme lactase. You genetically don't have that enzyme, so you can't digest lactose or sugar, and consequently, you can get quite ill when you eat dairy containing lactose.
Okay. Vamos a ver 3 definiciones fundamentales para comprender el mecanismo de la prueba. El primero de ellos es la definición de la alergia a los alimentos. Se define como una reacción inmunológica mediada por anticuerpos clase IgE o hipersensibilidad tipo 1. Es importante distinguir de la sensibilidad a los alimentos. La sensibilidad a los alimentos se define como una reacción inmunológica a los alimentos mediado por anticuerpos clase IgA o IgG. Esto es en tipo 2 y tipo 3 de sensibilidad. Sensibilidad retardada, perdón. Y por último, muy importante diferenciarlo de aquella intolerancia a los alimentos que no está relacionado con el sistema inmune. Esto es por una deficiencia enzimática. Por ejemplo, la carencia de la lactasa nos hará tener problemas con la lactosa. No podremos cortar este azúcar y tendremos intolerancia de índole metabólico. Aquí no hay sistema inmune. Go ahead, Mr. Brent.
So just a brief overview of food sensitivities in general. So food sensitivities and related diseases easily affect 100 million people worldwide, and that's extraordinarily conservative. But it just gives you some sense of the magnitude of the problem that is faced today. The prevalence of food sensitivities has increased significantly, so greater than 50% in adults and children in just the past few years. And I think we all have some feelings on that, but I think food processing and additives certainly play a role in this increase in food sensitivities that we're seeing. Symptoms, wide. So a variety of illnesses from skin rashes, headaches. One or all of the foods in a specific group may cause a food sensitivity. So when you design an elimination diet, that becomes important to understand the concept of cross-reactivity. Delayed food sensitivities, as I mentioned, they occur hours or days after food ingestion, and they may be quite pronounced at that time. Delayed food sensitivities are caused by IgG 1 through 4 and immune complexes that activate complement. We'll go over this quite a bit today, but the concept is foods cause antibody production. The antibodies bind to the food particles. They form an immune complex. They activate complement. generate inflammation. And the FIT test is the only test that's available out there that measures the innate immune system, which is the complement or the inflammatory pathway, and the antibody pathway, which is the acquired immune system. So remember that, and we'll talk about that a little bit as we move forward.
Ok. Vamos a revisar unos puntos muy importantes para las sensibilidades alimentarias. Vamos a ver que la sensibilidad de los alimentos, o sea, las enfermedades relacionadas a la sensibilidad de los alimentos, afecta a 100 millones de personas a nivel mundial. La prevalencia de la sensibilidad a los alimentos se ha incrementado un 50% en los adultos y niños en los últimos 5 años. Los síntomas variados de las enfermedades relacionadas a la sensibilidad a los alimentos son rash de la piel, dolores de cabeza, enfermedades crónicas del intestino. El 90% de las sensibilidades de los alimentos se ubican en 8 grupos alimenticios, como son la leche, soya, huevo, trigo, cacahuates, nueces, pescado y mariscos. Uno o todos estos grupos específicos pueden causar sensibilidad a los alimentos, es decir, solo un alimento de la leche puede causar sensibilidad, o todo un grupo de lácteos puede causar sensibilidad a los alimentos. Vamos a ver ahora lo que es la sensibilidad retardada. La sensibilidad a los alimentos retardada puede ocurrir horas o días después de la ingestión de los alimentos. La sensibilidad retardada a los alimentos puede ser causada, bueno, no puede ser, es causada por una clase IgG de anticuerpos, subclases del 1 al 4, y estos complejos inmunes son los que activan el complemento. La activación del complemento es clave para entender la sensibilidad a los alimentos. Bien, por último me gustaría mencionar que existen las reacciones cruzadas de alimentos. A eso se puede referir el grupo de alimentos que se ve en el punto del 90% de los alimentos. Si consideramos los alimentos cruzados dentro de un grupo de alimentos, podemos entender por qué un grupo de alimentos causa la sensibilidad a los alimentos. Go ahead, Mr. Brent.
In the next slide, again, just a couple of concepts. So you heard me say the innate versus the acquired. So innate is going to be complement. That means it's already there. And as soon as that system is contacted by various substances, it's ready to go. The acquired deals with antibodies, where you have to be exposed to a protein or a sugar, and then it takes a few days to acquire the immunity to that particular protein or sugar. So having said that, there are 3 basic levels of defense in the body. And the first is a barrier. So everybody knows the skin, the mucous membrane, stomach acid and enzymes, and various gut bacteria all provide kind of an external defense to the body. The innate immune system, as I mentioned, is a cellular compartment. So white blood cells, WBC, so neutrophils and macrophages, which phagocytize bacteria, viruses, and foreign proteins, very important. And then we move to another system that's already ready to go, and we're going to talk about quite a bit. It's complement. Complement deposits C3b on bacteria and other types of things, viruses and particles, so that they can be phagocytized very readily. And they're also, what the FIT test measures is immune complexes activate complement and generate inflammation. So we're going to show you how the FIT test uses that system to measure complement and that particular system in a simple test in the lab. And then acquired immunity, again, is white blood cells. There's another component that are T cells. So you've heard of T cytotoxic, T helper, and the antigen presenting cells, the dendritic cells. We'll talk a little bit about that. They ingest things and then they present these antigens to T and B cells, and they teach these cells to produce antibodies against these particular antigens, so you acquire the immunity to these foreign proteins.
Ok. En esta laminilla vamos a comparar la inmunidad adquirida versus la inmunidad innata. Hay 3 niveles de defensa del sistema inmune en contra de los agentes que nos causan daño, como los organismos químicos o proteínas ajenas al cuerpo. El primero de ellos serán las barreras físicas o mecánicas, como lo son la piel, las membranas mucosas, los ácidos estomacales, enzimas estomacales y la flora intestinal, o mejor dicho, microbiota intestinal. También tenemos como siguiente punto la inmunidad innata. Esto es mediado por la parte de los glóbulos blancos que forman los neutrófilos y los macrófagos, que van a realizar la fagocitosis de bacterias, virus o proteínas ajenas al organismo. El complemento, es decir, en su parte de la opsonilasa, entiéndase la C3b, cuando las bacterias tienen este elemento adherido a ellas, se activa el sistema inmune formando complejos que contienen clase IgG. Ahora vamos a lo que es a la inmunidad adquirida, que es mediada por las células T de los leucocitos. Las células T destruyen células cancerosas, células infectadas. Las células B o linfocitos B son los que producen los anticuerpos. Y así es como comparamos la inmunidad adquirida versus la innata. En nuestra prueba, en la prueba Food Inflammation Test, es de particular importancia la inmunidad innata, aquella que es medida por la clase IgG. Okay, go ahead, Dr. Brent.
So in the next slide, this is just a simple pictogram, and it gives you a sense of this is the gut epithelium, and it'll give you a sense of how antigens get through the gut wall and generate these immune complexes that we're talking about. So if you just follow the steps through from step 1 to 2, what happens is you consume something. It ends up in the gut, and it's either partially degraded or going to be degraded further. And then what happens is if tight junctions, and we're going to talk about this, are open in the particular tissue, and just follow the arrow right here. That's a tight junction. It's abnormal if they're open, and these food particles can get right through that tight junction, through the lamina propria, then they start interacting with cells in the Peyer's patches. That's the immune system there. So the T cells and B cells then are activated in steps. You can see steps 12, so 7, 9, and 12. So they get activated, and the business end of the stick here for the acquired immune system is these IgG antibodies. And what happens is immune complexes are formed because the antibodies are produced. They now find that food antigen, they bind to it, they form an immune complex. These immune complex can deposit in tissues, they activate complement, they generate inflammation through 2 key molecules, C3a and C5a. What the FIT test does is it measures C3d. And what that is that's a component that tells you that C3a has been generated. So we use that marker, and we'll explain that to be a surrogate, if you will, to show that inflammation has occurred. And then, of course, the end result of an immune complex is the symptoms. So that's what you'll see in the clinic as a result of C3A and C5A.
Bueno, muchas gracias. Bien, este pictograma lo que intenta ilustrar es todo el complejo mecanismo de inmunidad innata que está involucrado en el mecanismo de reconocimiento de alimentos y de inflamación por alimentos. De los puntos más importantes está estos dibujos que son como unos triángulos azules que están en las gap junctions o uniones entre los enterocitos, que cuando estos permiten que estos antígenos alimentarios crucen esta barrera de la lámina propia hacia lo que es la luz de los capilares intestinales, se está exponiendo antigénicamente y va a desatar un mecanismo de reacción inmunológica. Los pasos más importantes son los 7, 9 y 12, que son los que involucran este tipo de células, como las células T y las células B, que finalmente van a producir complejos inmunes. Estos complejos inmunes serán los responsables de causar la inflamación, activando la cascada del complemento. En esta cascada del complemento, una molécula sumamente importante es aquella llamada C3D. La C3D es la molécula que va a aprovechar la prueba FIT para poner en evidencia el mecanismo de inflamación que se está activando y que causará los síntomas de inflamación por alimentos. Go ahead, Mr.
Okay. In the next slide. So let's just talk about something very basic. So as I mentioned in step 12, we produce IgG, and that really is the business end of what activates complement. So IgG is produced, it binds to the food antigen and activates complement. And the C3D binding site on the antibody is in what they call the constant heavy 2 region right here. So that's very important. And you can see C3D. So the FIT test takes advantage of the fact that we can measure that marker, which tells us that inflammation has taken place and that C3A has been produced.
En esta laminilla vamos a ver lo que es la estructura del anticuerpo clase IgG. Como ustedes pueden ver, esta inmunoglobulina en su estructura es muy importante tener en cuenta la unión de la subunidad D del complemento 3 al anticuerpo. Cuando esta subunidad 3 del complemento está unida a este anticuerpo, formarán un complejo inmune, que es el que va a detectar la prueba. Go ahead, Mr.
So in the next slide, this is just a depiction of the 3 pathways that where you activate complement. We're going to focus on the classical pathway. As you can see, the antigen antibody complexes, they bind to a molecule called C1q. You don't have to be a complement biochemist and remember all this. Just remember that the classical pathway is activated by IgG containing immune complexes. And what happens is they activate an enzyme called C3 convertase. And there it is. You generate the inflammatory molecule C3A. But in so doing, you generate another molecule on the antibody, C3b, but it's quickly converted to C3d. So remember C3d because C3d is what we're going to measure in the test. Now, if this cascade, as it would call, continues, and it can in some individuals that don't clear immune complex as well, they activate a second enzyme, produce another inflammation marker, C5A, and then you can lyse your own cells. But we're going to stop right here at ICC3D. And remember, that's what the FIT test measures right there. So IgG alone plus IgG containing immune complexes that have C3D.
Thank you. Ok, en esta laminilla lo que vamos a observar es la cascada de activación del complemento. La cascada de activación del complemento tiene varias rutas de activación, la vía clásica, la vía de las lectinas y la vía alternativa. Cualquiera de estas tres vías va a activar la C3 convertasa, que es el disparo inicial para la activación en cascada de estas moléculas llamadas complemento. Va a activarse el C3D para producir C3A y C3B. Este paso es fundamental para la prueba FUIT o Food Inflammation Test. Por favor, recuerden, es muy importante hacer énfasis en la C3D. En este paso se va a producir y esta C3D es la que vamos a medir en la prueba. Esta C3D va a ser nuestra evidencia de la activación de esta cascada de la coagulación, disculpen, cascada del complemento, cuya función será hacer una lisis celular, como ustedes saben, cuando pasa de C3B por acción de la C5 convertasa, se activará la cascada del complemento. Esta cascada, una vez que se activó aquí, ya no hay marcha atrás. Se activará C3-5, C5B, C6, C7, C8, C9. Y estas proteínas producirán un agujero en la membrana celular y vendrá la lisis celular. Pero lo importante de aquí es, por favor, no olvidar la producción de la C3D. Go ahead, Dr. Dorval.
Okay, so the question becomes, okay, we have this test. We'll show you how it works. Why would you use it and when would you use it? So the patient comes to your clinic. And so in general, we say just doesn't feel well. So the general malaise is generally a complaint that we see as an overall catch-all. But what specifically? Autoimmune diseases, thyroid problems, arthritis, brain fog, fatigue, and digestive problems are a huge component of food sensitivities, as is other inflammatory conditions, fibroids, endometriosis, and breast cancer. So the overall idea is they present with symptoms at a clinic, generally or most often inflammation's involved. So now we're going to use a test to identify those foods so that the goal is to reduce inflammation so the patient will feel better.
Ok, gracias. ¿Cuándo los doctores utilizan la prueba FIT? Por lo general, los doctores quieren ver en los pacientes la prueba FIT cuando estos se sienten mal, pero también cuando tienen alguno o algunos de los siguientes síntomas o aparentes síntomas, como son enfermedades autoinmunes. Por ejemplo, puede ser la intolerancia al gluten, problemas tiroideos, artritis, nubulación mental o problemas cognitivos del cerebro, síndrome de fatiga crónica, problemas de la piel, del intestino o problemas digestivos, cáncer de mama, endometriosis o fibroidosis. Go ahead, Dr. Dorval.
So why would providers use this? So, excuse me, immune complexes and inflammation are associated with a variety of things, and they're the underlying problem for many conditions seen in your clinic on a daily basis. And we discussed the complement activation, but again, focus on the step where you generate C3A. That's what generates the inflammation.
Ok, gracias. En la prueba FIT, ¿por qué los doctores usan la prueba FIT? Porque los complejos inmunes y la inflamación pueden asociarse a los alimentos. Muchos problemas inflamatorios vienen con condiciones, como se pueden ver a continuación, en esta base de lo que es la activación del complemento. Nuevamente podemos ver esta cascada de activación del complemento mediada por la inmunidad innata. Cuando un doctor sospecha que un paciente tiene inmunidad innata activada, va a querer hacer la prueba FIT. Go ahead, doctor.
So again, the FIT test employs dual pathway measurement. The acquired immunity is the IgG component. It measures IgG 1 through 4, and the innate measures complement C3D.
Gracias. Es muy importante hacer notar que la prueba FIT utiliza dos rutas. Mide ambas inmunidades. La prueba FIT mide la inmunidad adquirida cuando medimos el anticuerpo clase IgG, subtipos 1 al 4, pero también mide la inmunidad innata con las anteriores laminillas, como lo explicamos, mediante la medición de la C3D. Go ahead, Dr.
So the FIT test technology was going to show you enhanced sensitivity. So on the left-hand side, you see a conventional test. And what you can see in a conventional test is they measure the antibody that's bound to the food antigen on the plate using a conventional, we call it a conjugate. And this is an anti-human IgG antibody that has an enzyme on it. So we can tell that we've located an antibody that's bound. So this will essentially find the antibody on the plate. Now, what you generate here is one signal, and the signal you're generating is for human IgG only. Now, contrast that with the FIT test on the right-hand side. So we take advantage of the fact that the antibody's binding. We generate that one signal that the other test measures, right, through the IgG 1 through 4, but we do something that's a bit more clever. We detect that C3D component that's bound to the antibody. Remember, we showed you that picture earlier. So that C3D is bound to the antibody right there. And what we do is we take advantage of that to measure a second signal. So the FIT test generates two signals for every signal that a conventional, quotation marks, test generates. What that does is it enhances sensitivity and also specificity, which are really, really important. And when you look at the FIT test report, what you see is nice, clean reactions in the bars with not a lot of background, meaning not a lot of false positives. So that's the basic concept. Old tests generate one signal. The new enhanced technology generates two signals, and it also gives you better sensitivity and better specificity.
Gracias. En esta laminilla lo que podemos ver es lo que ocurre en el pocillo de reacción de la prueba de ELISA que se utiliza para la prueba FIT. Del lado izquierdo pueden ver un test convencional que utiliza solo una señal. ¿Por qué? Porque solo utiliza anticuerpos anti-inmunoglobulina IgG. Ustedes pueden ver que solo hay una señal. En el lado derecho, en comparación con la tecnología que utiliza la prueba FIT, tenemos doble señal, dado que la prueba FIT utilizará también estos anticuerpos clase IgG, pero también utilizará como reactivo un anticuerpo anti-C3D, de tal manera que para dar positivo la prueba tendrá que tener ambos anclajes, ambas señales, y estas señales duales incrementarán notablemente el resultado, es decir, la sensibilidad a los alimentos. Son doble señal de la prueba FIT versus una sola señal de un test convencional. Go ahead, Dr. Dorval.
So as a fit test overview, I'm sure most of you have seen this test, but the fit test measures 176 foods, colorings, additives, and zonulin. And now we also have added 2 more molecules. Maybe we'll touch on them, occludin and candida, just as an adjunct a little bit later. So just keep those in the back of your mind, occludin and candida. We can take a sample by a finger stick. People love it. It's an easy, quick way to obtain a sample. Shipping is simple and generally costs much less to ship than a blood draw. The patient report may indicate leaky gut. So a lot of foods that become positive, zonulin is high, and later candida is high. And also another marker I'll mention is occludin. So remember that, high foods, high candida, high zonulin, and high occludin will all indicate some level of leaky gut. We have best in class compliance tools. So we have a great report. People love it. Easy to understand within seconds. We have an app for the phone so that you can reference your food sensitivity report on your phone. If you're out to eat, if you're at a restaurant, you want to make sure you don't consume something that you shouldn't. So you've got easy access to information. People love that. Everybody has a phone. And then we have a diet plan. So it's a basic diet plan based on your results that gives you some sense of if you can't eat certain foods, it directs you to foods that can be used to replace those. So people like that as well.
Ok, gracias. En esta laminilla lo que tenemos son los puntos importantes de la prueba FIT. La prueba FIT mide 176 alimentos, incluidos colorantes, aditivos y la sonulina, asimismo la cándida. La muestra es muy fácil de tomar, es tan solo un rápido piquetito en la punta del dedo y eso hace que sea muy fácil de obtener por el practitioner, por el doctor, por el nutriólogo, por el mismo paciente en su domicilio. Otro punto muy destacado es que el reporte de esta prueba puede indicarte que tienes intestino permeable. Y bueno, tenemos una serie de amenidades como son el reporte, aplicación, o sea, la app en un celular y el plan de alimentación. Esto es para facilitar el apego del paciente a la prueba. Go ahead, Dr. Brent.
So let's just talk a little bit about zonulin. You may or may not have heard of this protein, but it's a very important protein discovered by Alessio Fasano well over a decade ago, but people are really starting to realize how important zonulin is. So zonulin, what this is a molecule. So it's a protein that's produced in cells, and it opens tight junctions between cells. And so, as I showed you in one of the very first slides, these tight junctions by these little dotted, the blue, the green, and the rose colored, what happens is zonulin causes these to break down, and foods get from the lumen of the gut through into the lamina propria, and then activates the immune cells to produce antibody as well as a variety of other things. There are many, many things that can trigger the release of zonulin and the breakdown of these junctions, but we're all familiar with gliadin and its effect on various intestinal bacteria, and the net result is you get zonulin release and subsequent breakdown of the tight junction, which then allows food from the lumen of the gut to get through the gut wall, and then you start to produce antibodies.
En esta laminilla vemos un marcador molecular llamado sonulina. La sonulina es incluida en la prueba FIT por una razón muy importante. La sonulina es una proteína que nos indica que se están abriendo las uniones de los enterocitos y dejan o permiten el paso de antígenos alimentarios hacia la luz de los capilares intestinales. Cuando tenemos una sonulina aumentada, aumentará la apertura o la permeabilidad de estas células. Las gliadinas y las bacterias intestinales están ubicadas en estas uniones y cuando éstas se abren, pues se incrementa su paso hacia la luz, exponiéndolos al sistema inmune. Gracias, doctor.
So in the next slide, this is a little bit more detailed diagram of just what's going on with zonulin. So what's very important to understand is this one we just use gliadin because people are familiar with wheat and all the problems with wheat in people's diet. But remember, many chemicals, additives, bacteria, viruses can trigger the receptor or directly break down this junction right here. So this is called a tight junction, what I'm putting the arrow on right now. And you have occludin, and that's important. So just remember occludin. So what happens is you get fragments of something. They bind to a receptor and through a pathway. And everybody can go in more detail if they like. But there's a complex series of events that transduce the signal from the receptor and tell the nucleus to produce zonulin. Zonulin is then released into the lumen of the gut and it binds to a receptor right here. And that's the epidermal growth factor receptor. So zonulin hijacks this receptor and it tricks it into signaling the actin and myosin, which are attached to occludin in the tight junction here. And it pulls it apart just like a rubber band. So zonulin hijacks the receptor, sends a signal to the actin and myosin, and just like a muscle, it contracts and pulls apart the tight junction. And then what happens is what happens is that so what happens is a pore forms and the food particles get from the lumen of the gut. They get through and they start interacting with T cells, dendritic cells, and also macrophages. And what's important there is these cells regulate what actually happens with that antigen. And they're the kind of the traffic cops. And what they do is they say, okay, food antigen's gotten through, boom, let's produce an IgG antibody against that food particle so we can get it out of the body. So IgG forms, binds to the food antigen, but in the process of doing that, it also can activate complement and then generate inflammation. But just as important, what happens to the zonulin that's released? Some zonulin gets through that pore and is also engulfed by these cells. And also pieces of this occludin get through. So what happens here is a complex process, but I can simplify it by saying you get antibodies against food particles, you get antibodies against zonulin, and you get antibodies against occludin. And when you get antibodies against those molecules, it tells you that leaky gut has occurred at some level because the body normally would not produce antibodies against those particular molecules. So what we'll do is we'll discuss measurement of zonulin, occludin, and candida. So candida is found in the luminal side of the gut, but it's a normal flora. These pores are very small, but what happens is when these pores open, some of the candida antigens, once they lyse, they get through this tight junction, and now you also produce antibodies against candida. So with that information from the FIT test, knowledge about candida, knowledge about zonulin, knowledge about occludin, and knowledge about which foods are causing antibody reaction, then the clinician can say, okay, what level of leaky gut is occurring, if at all, and then how do I treat that? Perhaps with a gut healing protocol so that it would benefit the patient.
Gracias. Ok, en este pictograma se ilustra un complejo sistema inmune que nos llevará finalmente a tener anticuerpos contra la sonulina, anticuerpos contra la cándida, y se explica de la siguiente manera. Nosotros en el lado inicial del diagrama tenemos lo que es la luz intestinal. En la parte de abajo tenemos lo que es la luz de los capilares intestinales. Funciona de la siguiente manera. Tenemos fragmentos de gladinas o antígenos alimentarios que se van a unir a este receptor que se llama CXCR3. Cuando esta unión ocurre, dentro del enterocito ocurrirá un mecanismo de activación que nos llevará a que la sonulina, que está aquí diagramada de rojo y negro, va a decirle a la mitocondria que produzca y libere sonulina, la cual se va a adherir a este receptor llamado EGF y lo va a secuestrar. Cuando esto ocurre una, en este paso número 3 que ustedes pueden ver aquí, ocurre una activación de actina y miosina dentro del enterocito, lo cual retrae la unión entre las células, llamada en inglés gap junction. De tal manera que es abrir la puerta entre células del intestino. Cuando este mecanismo está abierto, ustedes pueden ver diagramado en estos triángulos o rombos de color verde, amarillo y rojo, antígenos alimentarios. Entre ellos puede haber la sonulina misma, que ya pasó, y así es como anormalmente podemos tener activación de células T y producir el anticuerpo contra la sonulina, o producir el anticuerpo contra la cándida o contra los alimentos. Aquí dentro de la luz de los capilares intestinales tenemos un complejo sistema de células inmunes, entre ellos los macrófagos, que son los que finalmente van a activar las células T, que van a finalmente a tener este anticuerpo clase IgG, que es lo que va a medir la prueba FIT. Go ahead, Dr. Dorval.
So in the next slide, so overview of zonulin. So zonulin, as we all probably figured out at this point, is involved in the generation of many, many types of diseases and symptoms. So it's a protein that's synthesized in intestinal and liver cells. So a couple of main sites where it's synthesized. It's a key biomarker for intestinal permeability. But remember, tight junctions are found throughout the body, in the brain, in the lungs, in blood vessels. So tight junctions aren't exclusive to the intestine, but their most pronounced, one of their most pronounced effects is upon the intestine. It's a reversible regulator, which means these junctions will be pulled open, but with time, they can close. And so when people shed food sensitivities, i.e. they're cured at some level, very often it's also associated with tight junctions which close up and the gut heals. Elevated levels of zonulin are associated with autoimmune, adult glucose intolerance, celiac, obesity, type 1 diabetes, multiple sclerosis, etc. So just we don't have to discuss all of these, but you get the idea. Zonulin is in many organs and it will manifest itself in many different diseases and disease processes.
Vamos a ver en esta laminilla una revisión de los puntos clave de la sonulina. La sonulina es una proteína que es sintetizada en el intestino y en las células del hígado o hepatocitos. La sonulina es un biomarcador clave en la permeabilidad intestinal. Es un regulador reversible y el único de la permeabilidad intestinal. Los niveles elevados de sonulina se han asociado con los siguientes padecimientos: enfermedades autoinmunes, enfermedad celíaca, sensibilidad al gluten no celíaca, artritis reumatoide, diabetes mellitus tipo 1, intolerancia a la glucosa en adultos, enfermedad inflamatoria del intestino, obesidad, esclerosis múltiple y enfermedad del hígado de grasas no alcohólicas juvenil. Go ahead, Dr. Dorval.
So problems with zonulin protein assays out there. So we're probably all familiar with zonulin and measuring it, at least at some level. There's a lot of problems with this assay. And the main problem is, number one, is cross-reactivity. So you really don't know what you're measuring because all these assays have one thing in common: cross-reactivity, because they measure haptoglobin, properdin, various complement fragments, and they actually block the binding of zonulin. So you're not really measuring zonulin. You may be measuring a little bit of zonulin and a lot of these other proteins, or vice versa. So there's a high degree of uncertainty because of the cross-reactivity. Sample timing. Concentration in serum varies widely during the day and results in difficult in getting an accurate sample. And in one study, they showed that zonulin levels can go from positive to negative in as little as 4 minutes. So you can imagine sample timing is very, very critical and really almost impossible to standardize. The sample type that's typically used is serum and fecal testing. And of course, in this lab, we don't do fecal, we just do serum and dry blood spots, which we'll discuss.
Ok, en esta laminilla se ilustran los problemas principales con la medición de la zonulina en la técnica de ELISA. El problema número 1 es la reactividad cruzada de esta proteína. La zonulina tiene una reactividad cruzada con la haptoglobina, con la properdina y con fragmentos del complemento. Y bueno, estos resultados, esta reactividad cruzada resulta en bajas tasas de positividad. Ahora, un problema que se ha encontrado es el tiempo de muestreo. La concentración en suero varía ampliamente con el día en que los resultados se obtienen. Entonces, para obtener una medición acertada, hay que hacerlo en un tiempo breve de muestreo. Y otro problema es el tipo de muestra. Puede ser suero o fecal. En algunos estudios, la prueba fecal es más acertada que la de suero. Gracias, doctor. Go ahead.
So what we've done is we've done something that's a little bit clever, if I can put it that way. So we've decided to measure zonulin antibody, and it resolves problems for the zonulin protein ELISA. So as you remember, protein antigens get through the gut wall and sugars when the tight junction is open, but also zonulin protein gets through. So what happens is the cells produce an anti-zonulin antibody. So that's a key feature that we now measure. So what that does for us is it eliminates cross-reactivity. And we use a unique recombinant zonulin that only KBMO has. We clone the human protein. No other company has done it like we've done it. And so that eliminates cross-reactivity and the binding to haptoglobin, properdin, and other complement fragments, and the cross-reactivity that occurs as a result of that. So the unique protein, zonulin, that we cloned and company owns can capture that antibody after it's been produced, after it goes through the tight junction. So we measure that. So the positivity rate goes up significantly because zonulin blocking is eliminated, and when you do that, the positivity rate now goes up to where it should be, and where Alessio Fasano in his studies has found. So we can match that pretty well. Sample timing now is no longer important. Once you produce an antibody, it's stable for days, if not a week or two, so that, wow, that's easy. You can take a sample pretty much anytime, and you don't have to worry about sample timing. What we've done is something that I don't think anybody else has done as well, is we can now measure it off a dried blood spot or serum. And we've shown that serum and dried blood spots are equivalent when we look at the measurement of zonulin reactivity. So again, people like dried blood spots, simple, easy to ship, etc. And of course, we do not test, if this is not a fecal test.
Gracias. Bien, en esta laminilla se hace ver que al medir el anticuerpo clase IgG de la solanina, resuelve los problemas que se vieron en la anterior laminilla al medir directamente la solanina por prueba de ELISA. Entonces, al medir la prueba FID, el anticuerpo clase IgG de la solanina, se resuelven los siguientes problemas. Uno, elimina la reactividad cruzada. La proteína recomendante única de sonulina elimina la reactividad cruzada con la haptoglobina, con la properdina, con los fragmentos cruzados del complemento. Otro problema resuelto es la tasa de positividad, que se veía afectada con la medida directa de la sonulina. Ahora, midiendo el anticuerpo clase IgG de la sonulina, se elimina este bloqueo y las bajas tasas de positividad. Otro problema resuelto con esta medida es el tiempo de muestreo, puesto que la concentración de anticuerpo clase IgG de sonulina es mucho más estable en suero, lo cual asegura una medida muy acertada en la prueba FIT. Y otro problema que resuelve definitivamente es que ya no habrá que ver si es fecal o de suero. Simplemente no es una prueba fecal, no hay manera de medir IgG en materia fecal y siempre será en suero. Y bueno, entonces tenemos que la muestra ideal son las gotas de sangre, como lo hace la prueba FIT. Gracias, doctor. Go ahead.
So we call it the next generation zonulin assay. It's the zonulin IgG antibody screening assay. And again, I just want to emphasize, no one else has this recombinant zonulin. You'll see it elsewhere, other catalogs, maybe other companies, but they don't have it. We are the only source of that. We launched it in March, and it's exclusive to KBMO. And as I mentioned, it measures zonulin IgG and also IgA, I might add. So we're adding panels almost daily, or things to the panel almost daily. And it's a more stable and specific marker than zonulin protein. So that's the real take-home message. It's more stable and it's more specific. It eliminates cross-reactivity seen in the other assays. And the test format, again, it's a standard ELISA right in the FIT test. You add that right along with your other food sensitivity testing. And we can use serum, or for your convenience, a blood spot. And not coincidentally, these are the samples that Dr. Fasano used in his research. A dream development team, certainly for Dr. Fasano, he discovered zonulin, and he's partnered with KBMO and helped us quite a bit. So we give him a great deal of credit. And myself, I had developed the first rapid HIV diagnostic some years ago. So between Dr. Fasano and myself, when you put two of us together, we're kind of dangerous. So the FIT 132 and the FIT 176 will include zonulin screening assay as soon as we launch. So we've launched. It is included and we'll have other markers that will add to that gut permeability panel in very short order, and we'll be happy to let everybody know then.
Ok, en esta laminilla podemos ver que KMBO en exclusiva tiene la reactividad o utiliza el ensayo de anticuerpo recombinante IgG de sonulina. Este desarrollo exclusivo y punta de lanza en las pruebas de ELISA de intolerancia e inflamación a los alimentos es producto del equipo de ensueño del doctor Aleso Fasano, que es quien descubrió la sonulina, y el doctor Brent Dorval, que con sus investigaciones llevaron al desarrollo y el Research and Investigation, el ID, de lo que es punta de lanza en la medición de sonulina. Gracias, doctor Dorval. Go ahead.
So let's just discuss really applying this test to a few clinical situations. In the first study, what we did was we looked at a retrospective. So we had lots of data on samples that were tested and so forth. So let's get a subset of those samples and just kind of see if we can't get a snapshot of what's going on. And so we looked at about, I believe there was about 30 in this study. And so what happens is we looked at the patient when they first came in, and we gave them a symptom checklist. And we asked them to score their symptoms from high to low. And generally when they came in, their symptoms were kind of on the severe end of the scale. And then when we tested them, what we found out was there was a lot of severe, high, and moderate food sensitivity. So we could, in other words, we had a lot of high signals on the food sensitivity test, indicating a high titer of antibody against certain foods and additives. And then we waited 10.7 months after we said, eliminate those foods from your diet, come back in 10.7 months later, that was the average. And then we'll say, let's look at the symptoms. So uniformly, the symptoms were reduced almost across the board. So for instance, a person might have been complaining, I have a headache almost every single day, and it's very severe. After 10.7 months, they're saying, I eliminated the foods that you recommended. Yeah, I still get an occasional headache. It's not nearly as severe, and it's not nearly as often. Maybe I have a headache once every 2 weeks, and it's much milder. Then when we looked at their serum sample, what we found, and as you can see on the right-hand side, the IgG and immune complex load or levels went down significantly. So what we saw was you took the test, you followed the results in an elimination diet, your antibodies went down, and your symptoms actually resolved to a great extent. So what we found as an overall conclusion is a significant reduction in sensitivities were reported after the elimination diet, which indicates, and what's important about a test, it could predict certain food sensitivities, and the patients got better. So we said, wow, this is a very good study, even though it's a retrospective study.
Gracias, doctor. Bien, en esta laminilla tenemos unos diagramas o gráficos de un estudio clínico efectuado a 30 pacientes. En estos 30 pacientes se midió la IgG y la C3D en una prueba PIT. Y en un promedio de 10.7 meses después de eliminar de la dieta los alimentos que marcaban la prueba, observamos francamente la disminución del número de sensibilidades en las pruebas FIT. Lo que ilustra esta laminilla es la eficacia de eliminar de la dieta los alimentos que la prueba FIT te muestra como resultado. En este estudio clínico de 30 pacientes podemos ver muy claramente cómo hubo pacientes que tenían entre 50 y 60 de actividades Y en un promedio de 10.7 meses después de haber eliminado de la dieta estos alimentos, el más alto apenas rebasa los 10 resultados o los 10 alimentos mostrados en el resultado. Gracias, doctor. Go ahead.
Okay, so in the next one, what we wanted to look at is something that's very frequent that we see daily, and that's irritable bowel syndrome. Its occurrence is 18% in just North America alone. That's very significant occurrence. Medical care, also significant. 25% of that group need to seek primary, secondary care for some sort of symptoms, and even 5% of those ended up in a tertiary care setting, which means you ended up in the hospital. The cost was sizable direct costs, as you can imagine, for physicians, ER, diagnostic tests, and various types of medications. So it's very frequently seen, its occurrence is high, and the cost to the patient and the medical community is very high.
Ok, en esta laminilla vemos lo que es el síndrome de intestino irritable y tenemos estos tres principales aspectos a considerar. Uno es la ocurrencia. Se tiene que el 18% de los norteamericanos tienen el síndrome de intestino irritable. El 25% de los enfermos se encuentran en la atención primaria y secundaria y acuden por los síntomas. Y solo el 5% se encuentran ya en la atención terciaria. Y un aspecto muy importante son los costos. Se tienen costos directos o medibles en las visitas al doctor y las visitas para diagnosticarse y para hacerse la prueba. Y para los tratamientos con fármacos. Es decir, el síndrome de intestino irritable puede llegar a ser considerablemente costoso. Go ahead, Mr. Brent.
Okay, so it was in, again, IBS study, irritable bowel, and we evaluated the health benefits and outcomes of IBS and food sensitivity using the FIT test for IgG4, 1 through 4, and immune complexes. And the principal investigator was William Esselfy, an MD in California.
Tenemos el siguiente estudio clínico. Vamos a ver los resultados de un estudio clínico de la enfermedad o síndrome de intestino permeable. Se van a evaluar los resultados en pacientes que utilizaron la prueba FIT, que mide la IgG, son clases 1 al 4, al mismo tiempo que medir la C3D. Go ahead, Dr. Brent.
So we'll just go right to the results of this. So they used the FIT test, obviously, to predict food sensitivity. So they did the same as the previous study. They took measurements, they went on an elimination diet, and here's the results that we got from that study. So the severity score from day 1 to the end of study, EOS was 0 is low and 500 is high. And the intervention group, meaning those that abided by the FIT test results, they had a 127-point decrease, very significant. And the control group had a 46-point decrease. So you can see about a 2.5-fold at least, or even almost 3-fold difference. Homocysteine, important measurement to make less than 15 micromoles per liter is where they want you to be. So in the intervention group, they had a 5 micromole decrease, and in the control group, they actually had a 6.4 micromole increase. So again, the intervention group, the idea is you want a decrease in homocysteine, and we saw significant decrease there. And the C-reactive protein, so that's a protein that measures generalized inflammation. Now, you don't know what the inflammation could cause it. It could be caused by a variety of things. But in this group, we're looking at the level of CRP after intervention. And you can see in the intervention group, there was a 0.5 mg per mil decrease, and control group, a 0.1 mg per liter decrease. So in each case, for each marker, what you can see is a significant decrease from the control group and the intervention group, which shows us, again, that the test could predict. So if you follow the test results, it could predict the sensitivities. And if you remove those foods in general, you'll get better.
Ok, en la siguiente laminilla tenemos los resultados de este estudio. Se emplearon para ello 3 marcadores, que es el score propiamente de la enfermedad, la medición de la homocisteína y de la proteína C reactiva. En estos 3 marcadores se utilizaron siempre grupos de intervención o los grupos de pacientes que se les dio la prueba y el grupo control. Siempre el grupo control es para comparar el resultado del grupo de intervención. Entonces, tenemos que se le da la prueba al paciente. Entonces, tenemos el día 1 hasta la eliminación de la dieta para ver qué fue el efecto del marcador. Es decir, en el score o el marcaje de la enfermedad, desde el día 1 hasta que se elimina de la dieta, tenemos que en el grupo de intervención hubo 127 pacientes que decrementaron o bajaron la incidencia de tener la enfermedad. Y en el grupo control tuvimos 46. Ahora, cuando se mide la homocisteína desde el día 1 hasta la fase de la eliminación de la dieta, tenemos un dato menor a 15 microgramos por litro. Tenemos que el grupo de intervención disminuyó 5 microgramos, o sea, 5 micromolar de homocisteína desde el día 1 hasta la fase de eliminación de la dieta. El grupo control lo incrementó en 6.4 micromolar. Cuando se utiliza la proteína C reactiva como indicador desde el día 1 hasta la eliminación de la dieta, se tiene que es de 1 a 3 miligramos por litro. El grupo de intervención lo decrementó o lo redujo en 0.5 miligramos por litro. El grupo control lo decrementó o lo redujo en 0.1 miligramos por litro. Go ahead, Dr. Brent.
So again, just some additional results, which is very, very important. Hospital stays and visits in this patient group reduced 10%. I mean, that's very significant. And primary care physician and specialist office visits decreased 50%. Almost astounding when you really think about that. So again, the data is based on a small group. It's 100 patients, but it was randomized correctly to control and intervention groups. So I think the data is very solid, very, very important findings.
Estos resultados son fundamentales que prueban la efectividad de la prueba FIT en el estudio de la síndrome de intestino permeable, puesto que en este protocolo clínico se puede observar un 10% de reducción de las visitas al hospital de los pacientes que participaron en el grupo de intervención y un 50% de reducción a las visitas al doctor del grupo de intervención de este estudio clínico. Entonces, estos datos se basan en 100 pacientes al azar y grupos de control. Go ahead, Dr.
A few more studies. When we look at the actual clinical outcomes, again, so this good correlation from FIT testing and clinical outcomes. The FIT test resulted in twice the IBS severity score reduction when you compare it to cellular tests. Now, there are other cellular tests on the market. I don't need to mention the names. You can look them up. Suffice to say, cellular tests did not perform nearly as well as the FIT test. And then when we looked at IgG only tests, the FIT test resulted in 50% improvement in IBS severity score compared with tests that measured IgG. So remember, these tests measure only the acquired part of the immune system. KBMO FIT test measures the acquired and the innate immune system, the inflammatory component, and that makes a big difference when you consider clinical outcomes. So the clinical outcomes for IBS are greatly improved when using the FIT test to predict the food sensitivities. And again, it's the inflammatory component is the only difference. And now you see in a clinical outcome why measuring that in addition to IgG is very important.
Ok, en esta laminilla vemos la gran significancia de la prueba FIT en este protocolo del síndrome de intestino permeable. La prueba FIT resultó en 2 veces la reducción de la incidencia, la frecuencia del síndrome de intestino permeable en pacientes en comparación con las pruebas celulares o normales. La prueba FIT resultó en un 50% de mejoramiento en la frecuencia de la enfermedad de intestino irritable, comparándolo con las pruebas que solo miden la prueba IgG. Es decir, la FIT test te da una sensibilidad tal que tendrá 50% de mejora en la incidencia de esta enfermedad. Entonces, la conclusión general es que los scores o las frecuencias de tener la enfermedad de irritable de intestino se mejoran enormemente cuando un doctor emplea la prueba FIT en los pacientes, dado su sensibilidad. Go ahead, Dr. Brent.
So just to summarize what we've talked a little bit about tonight is multi-pathway detection. So remember, it measures acquired and innate. So acquired IgG and innate complement. Other tests only measure acquired IgG. Complement generates inflammation. So we look at C3D. The fact that we can measure C3D tells us that complement's been activated and has generated inflammation. So we say we have an inflammatory component to this test. Antizonulant antibody is a marker for gut permeability. Now we mentioned 2 others, occludin and candida. Those tests will be coming out in the very near future, and that will round out the gut permeability panel. So this test will be even better at predicting food sensitivities because we're going to specifically look at leaky gut. And as you saw in both studies, we had excellent clinical outcomes. And the last study was backed by an IRB approved clinical study. So that was IRB approved, which is very important. And the first study is a study that was actually published in a journal. So that is a peer-reviewed study. So very important. So thank you very much for that. That will conclude what I'm going to say tonight.
Y recordarles acerca de nuestro 6º Congreso de Medicina Funcional e Integrativa, que ya lo tenemos en puerta, ya 6 y 7 de mayo, en Cancún, México, donde vamos a hablar justamente de todos estos temas de cáncer y hormonas, nutrigenómica, optoenvejecimiento, resistencia a la insulina y, por supuesto, va a estar presente Q.B.P Diagnostics ahí en donde están en Cancún. El evento va a ser en el Iberostar Selection, un hotel todo incluido, 5 estrellas con un todo incluido de lujo, muy bueno. De hecho, nos quedan ya muy pocas habitaciones. Los ponentes que estarán presentes, la doctora Feliz Gersh, el doctor Jeffrey Zuckerman, la doctora Jael Hoff, Ryan Smith desde acá de Estados Unidos y también, por supuesto, Fabio Dos Santos desde Brasil. Y, por supuesto, aquí también de México, la doctora Sofía López López, el doctor Luis Bernardo Cepeda, la doctora Maribel Quiroz y el doctor Daniel Valencia Torres. Para más información pueden ir directamente a la página web www.congresomfi.com o bien enviar un correo electrónico a hola@bioh.mx. Pues parece que estamos completos de preguntas, parece que no hay más preguntas, más comentarios. ¿Algo que quisieran comentar para cerrar? Roberto, James, Dr. Brent.
James, Dr. Brent, something you want to for closing?
From my end, no, it was a pleasure to be here tonight. We're going to keep you posted on the new developments. We didn't include the occludin and candida results because they just came out and we didn't want to kind of jump ahead of ourselves. So you'll be hearing about these panels in the very near future. And as I mentioned, any questions that you have, whether now or in the future, feel free to contact us by email or phone, and we'll be happy to get right back to you. And I appreciate the opportunity. Thank you.
Thank you, Brent. Ahora sí que el doctor Brent nada más quiere agradecer el tiempo y ahora sí que el tiempo que ha tomado explicar todo y poder dárselo a sus colegas, a ustedes. Y los esperamos el 6 y 7 de mayo en Cancún para el Congreso. Vamos a tener bastantes promociones, vamos a tener ahora sí otra conferencia ahí en presencial y ojalá nos puedan acompañar.
Excelente. James, something to close?
Yeah, I mean, I think just to add to Dr. Dorval's point there, you know, it's a unique test, as he quite rightly pointed out, where we're looking at the food sensitivities, the inflammation, and now the gut permeability or with the gut barrier panel all on one test. So it gives you a way of, rather than guessing, is it a food sensitivity or leaky gut? Now you don't have to guess, it's all on one panel, which I think makes it unique and will hope you as a provider as well as your patients.
James está diciendo que ahora que es una prueba realmente única en el mercado, que no vamos a tratar de adivinar si es inflamación o intestino permeable. Esta prueba abarca las dos y en lugar de adivinar realmente vamos a saber con certeza y le va a ayudar tanto a su clínica como a sus pacientes.
Excelente, excelente. Muchas gracias. Thank you, James. Tú, Roberto, por tu parte, ¿algo para cerrar?
No, pues agradecerle a todos los que atendieron, agradecerles por su tiempo, por su comprensión y esperamos verlos el 6 y 7 de mayo en Cancún y en el Congreso, y cualquier duda que tengan, no duden en contactarnos por las páginas de internet que ya se puso aquí en el chat.
Excelente, excelente. Pues muchísimas gracias a todos. Muchísimas gracias, Brent. Thank you so much. Thank you, James. Gracias, Roberto. Esperamos vernos en el próximo webinar. Les voy a enviar la invitación del siguiente. Me parece que tenemos uno este jueves. Ahí les mando la información por correo electrónico para que también se conecten al siguiente webinar. Y pues, por supuesto, nos vemos en Cancún 6 y 7 de mayo. Muchas gracias a todos. Excelente tarde. Gracias.
Gracias, Germán. Hasta luego. Thank you, Dr. Brent.
Thank you, Herman.
Thank you, James.
Thank you.
Thank you, Herman.
A pleasure.
You're welcome.
Thank you. Have a good night.
Thanks, everyone.